You are receiving a male patient with decreased consciousness and forced respiration. The past 3 days, he has been coughing with increased sputum production. You perform a general assessment. Your lung auscultation reveals sonorous rhonchi and prolonged expiration. As his breathing is acutely affected, you provide oxygen supplement. The patient, Mr. Wang, has been smoking 20 cigarettes a day for 20 years and still does. He has been hospitalized frequently, diagnosed with COPD, and treated for high blood pressure. Right now, where immediate action is required, the big question is, what is causing this condition? Is Mr. Wang suffering from heart failure? Is it an exacerbation of the COPD? To provide the right and immediate treatment, you need answers fast. Mr. Wang's blood holds vital information about his current condition, and a blood gas analysis will reveal the pulmonary gas exchange, if Mr. Wang is sufficiently ventilated and if he's able to get rid of carbon dioxide. A blood gas analysis using the ABL analyzer provides you with a lot of valuable data. In this case, it will show the exact pH, PCO2, and the concentration of bicarbonate, making it easy to assess the acid-base balance in Mr. Wang's blood. Furthermore, the patient results from the ABL blood gas analyzer will help you assess if Mr. Wang's condition is acute or chronic. The ABL analyzer will give you the results within a very short time, which is crucial in a severe case like this. Start by collecting a blood sample from an artery to ensure the best possible picture of patient status. The arterial puncture requires a very specific procedure in order to ensure reliable results and not cause complications. Place the syringe in the ABL analyzer inlet. Shortly after, you will receive the patient results. The oxygen level is low, and something must be done about it. But is this a case of acidosis or alkalosis? The tic-tac-toe method is a clever way of making fast assessments. You look at the pH, PCO2, and the concentration of bicarbonate shown in the patient report and compare them with the reference intervals. Now, depending on whether a value is below or above the reference interval, you note it either under acidosis or alkalosis. In this case, you have 3 in a row in the acidosis column. This shows respiratory acidosis with slight metabolic compensation. You therefore decide to treat the carbon dioxide accumulation. You initiate appropriate respiratory support and repeat the arterial blood gas analysis on a regular basis. You need to repeat the analysis several times in order to monitor the effect of the treatment. The second test shows that the pH and PCO2 values have improved, so the therapy has the intended effect. But the PCO2 is still above normal for this patient. The third test shows further improvements. After the fourth test, you conclude that Mr. Wang needs continuous respiratory support. And even if the carbon dioxide is still above the reference interval, it must be considered within the normal range of this COPD patient. After another 30 minutes, Mr. Wang is more alert. He now sits upright and answers your questions in a clear voice. Additional examination shows that Mr. Wang has pneumonia in the lower right lobe. Mr. Wang will need to be hospitalized and treated until he improves. Using the ABL analyzer enabled you to make an early tentative diagnosis and implement a targeted therapy. It also allowed you to follow the effect of your treatment. This patient survived a life-threatening situation without the need for invasive therapy. The ABL analyzer allows the assessment of the respiratory and metabolic status of the patient, and regular blood gas analyses enable you to make early assessments of acute changes. Watch the other case videos to see how the ABL blood gas analyzer can aid in the diagnosis of diseases.